The new Premier of New South Wales has announced substantial changes to the state's reopening timeline. Reporter Manos Anguri joins us now from Sydney. Manos, g'day. So what's Dominic Perrottet had to say?
Good morning, Joe. That's right. So some significant changes announced today. Yesterday, Dominic Perrottet told us that we have reached that 70% double vax milestone. So that means that we are on track to open up on Monday and enter stage 1 of New South Wales roadmap out of lockdown. But that looks to be a bit different to what we initially expected. So from Monday, indoor swimming pools will be open and the cap on visitors inside the home will be increased from 5 to 10 people. Outdoor gatherings will be increased from 20 to 30 people, and caps on weddings and funerals will also be increased from 50 to 100 people. Then once we go towards the 80% milestone, which is supposed to happen in the coming weeks, 30 people will be allowed inside the home, 20 people will be allowed inside the home, and 50 people will be allowed in outdoor gatherings. Masks will be removed at that milestone, so when we reach 80%, masks inside the office will be removed then. That was initially supposed to happen on the 1st of December, and outdoor events will be increased from 500 people to 3,000 people, provided they are controlled and ticketed. There's also going to be changes to schooling. So the stage 1 of going back to school is still set on October 18th. That's when years kindergarten, year 1 and year 12 will go back. But on October 25th, all other grades will be able to go back to school. And this move has been welcomed by the Education Minister, who says that students learn best face-to-face. So she's very happy with this move as well. So a lot of changes ahead, but the Premier, Dominic Perrottet, has assured that extensive discussions have taken place in regards to this.
These changes today are measured, sensible, and ensure that we open up in a very safe way. I met yesterday for some time with Dr. Chant and with Minister Hazzard. We ran through a whole range of issues. We then took some suggested changes to the roadmap to the Cabinet meeting last evening. It was a long meeting, but one in which I think was constructive, productive, and these changes today I think will make a real difference.
And Manos, what are the changes for regional workers?
That's right. So from Monday, regional workers will be able to go back to work if they've had 1 dose of their vaccine and they've been given a grace period until November 1st to get fully vaccinated. The Deputy Premier says this change was made because it has been harder for people to access the vaccine in the regions, so they've been given some extra time.
And the Health Minister announced some of the COVID numbers today.
That's right. So it seems like we're moving away from the 11 a.m. presses. We got the numbers quite early today, and that's expected to continue. Yesterday we recorded 587 cases overnight. So that's another day of low case numbers. So the numbers are stabilising, and we do look good on track towards reopening. But the Health Minister, Brad Hazzard, has of course warned against complacency and has urged people who haven't gotten vaccinated yet to come forward, get their vaccine, so we can reach those milestones even sooner.
OK, Manos Anguri reporting there from Sydney. Let's head south into Victoria now. It's seen another relatively substantial rise in COVID cases today. In fact, its second worst day. 1,638 new locally acquired infections have been detected and 2 people have died with COVID. So in terms of cases, that's a rise on yesterday's infection total, but lower than the biggest jump recorded on Tuesday. So Victoria's in a race to reach 70% full vaccination. Currently 54.5% of people 16 and over are fully immunised, while 83% of people have received at least 1 dose. And reporter Leanne Wong joins us now from Melbourne. Leanne, g'day. So take us through those figures today.
As you mentioned earlier, this is the second worst day that Victoria's recorded since the start of the pandemic. Another 1,638 new local infections, and that makes it the 8th straight day where we've recorded cases over 1,000, so certainly not trending in the right direction. Now, sadly, another 2 more Victorians have also died due to the virus, though thankfully it's not as many deaths as we saw yesterday when we hit that record high of 11 Victorians passing away due to the virus. And it takes the total death toll connected to this outbreak alone to 70 cases. And overall, there are now more than 15,000 active cases across the state. And that's about double that we saw during the peak of our second wave last year. Now, unfortunately, it looks like, according to modelling, we won't be peaking for another few days or even weeks. However, we are inching closer to our target date of our 70% fully vaccinated target date, which is when Melbourne will be able to exit its lockdown, with 83% of Victorians having received at least one dose of the vaccine and 54% fully vaccinated.
And Leanne, what can you tell us about that spot you're standing in front of there?
Right, so I'm currently at the Royal Children's Hospital here in Melbourne, and the cancer ward here has quite concerningly been designated a Tier 1 exposure site after a parent of one of its patients tested positive for the virus. It's believed the parent visited the hospital, visited the cancer ward, in fact, from Saturday to Monday, and is now tested positive. And what that means is now that all patients and parents who are connected to this ward will need to isolate for 14 days. So if they've already been discharged, they'll need to isolate at home. And if they're currently still in hospital, well, parents will need to isolate in their child's hospital room for the full 14 days. They won't be allowed to leave the room or roam around the hospital. They also won't be allowed to have any visitors. We also just got an update from the Royal Children's Hospital Chief Executive, Bernadette McDonald, and she says that so far, thankfully, no one else has tested positive, and that because staff were wearing full PPE, thankfully also no staff need to be furloughed, particularly as the hospital's already under considerable strain. And this also comes off just this morning. We've heard that another Victorian hospital has been affected due to the virus. So Mildura Hospital, that's in the regional city of Mildura, all the way up north by the New South Wales border. Well, they've had to stand down 60 of their staff. They've been forced into isolation after one of their patients spent 2 days there and then also subsequently tested positive. They've had to cancel all non-urgent surgeries. So certainly Victoria's healthcare system continues to be under considerable strain.
Okay, Leanne Wong reporting there from Melbourne.